range of movement using the band. There needs to be a sufficient amount of tension, usually about close to 40 or 50 pounds, depending on your body weight. And we're going to start in a stride stance, and we're just going to gently oscillate into a kind of a hip abducting position. The band kind of pulls me in, and I get a deep stretch in my groin. And then I do it to the other side. And I have a direct line of pull, so it's very linear. I start off, I go for about a minute, and I just gently oscillate into the joint and back out. Next, I'm going to go into what is like a hip hinge or a deadlift. So I'm trying to push my hip outside, like out of the back pocket, if you will. And the band's kind of pulling and resisting that, and I'm going to use that tension almost eccentrically to kind of push off into this corner. And I just gently come in, hang out for 10 seconds, feel the tension, kind of breathe into it, and then come back out. I'm going to repeat that same sequence, 1 minute in duration, about 10 seconds. I'm going to go at every 45 degrees. So I'm going to go here, I'm going to rotate away, 45. I'm eventually going to go directly purely back. I may need to take a step forward and go back. I go 45 like this, where it's kind of pulling me back and out that way. At times, as I get into that quadrant, I could just like move myself away. Either way, it's fine. But if I wanted to just continue to pivot in that position, I can. I'm trying to, again, kind of push that hip out, allowing the band now to kind of work with me to assist in that pull. We call it tissue priming. So now my tissue, maybe I warm up with the bike, go for a walk, warm up my tissues. I go around the world with the hip, and now it's ready and a little bit more lubricated, ready to accomplish the hip mobility regimen that's about to be.
Okay.